Thank you. Good morning and welcome to Flashpoint, the voice of national unity. I'm David Cote. I'm here on every Friday at 10:30 with medical practitioners. Most of my guests are medical people. Sometimes we bring in politicians. Today is no exception. We have in studio two medical practitioners from the Jahmale Medical Solutions. Mrs.Esther Mutemwa Dorr is a pharmacist there, and she's been here before. This is your second time. Welcome back to Flashpoint.
Thank you, Mr. David.
All right. We also have Dr. Winston Jallah. He's also a pharmacist from the Jahmale Medical Solutions. Today we're going to be talking about this whole thing about pharmacists, the importance, their duties, and the dangers, and not having the right person in the right place. So we are here for 1 hour. During the first 30 minutes, we're going to be asking you to um, say something about this different. But please introduce yourself at least a minute.
Thank you once again, Mr. David, for having us. And good morning to our listeners. My name is Mrs. Esther Mutemwa Dorr. I'm a pharmacist by profession. Besides that, I'm also a mother and a wife, and I'm glad to be here.
Oh, thank you. Thank you. Dr. Jallah.
Thank you, Mr. Koti.
Yeah. Oh, you want to call me doctor too? Yeah, I'm very sure yet.
Okay. I'm Dr. Winston, Jallah, an intern pharmacy at Jahmale Medical Solution. I have a pharmacy doctorate degree, which is PharmD.
Oh, okay.
And I love sports and.
You love sports?
Yes, of course. And
are you an IE or Borough person? Which one?
I cheer for Manchester United.
Oh, I see.
Yeah, FC Fasel in Liberia.
Oh, all right. But then, at least you love something in Liberia, right?
Yes. So.
Okay.
Okay, so I love reading. That's my habit when I'm home most of the time.
All right.
Okay.
That's good. That's good. Thank you. Now, let's keep the ball rolling with you, Mrs. Dorr. Who is a pharmacist? And before you explain that, I just want to ask you one quick question here. What is the difference between a pharmacy and a drugstore? I'm confused.
Okay.
We see medicine in those two places.
I know.
Yeah.
So let me start by differentiating a pharmacy from a drugstore.
Okay.
A pharmacy, by law, is an institution that stocks all medications for over-the-counter, like over-the-counter products, anti-allergies, drugs that you really don't need specialized care to have them. So basically, that's the difference.
Okay, let me get it again.
Yes.
A pharmacy is where you do what?
Where you get all the drugs that can ever be, whether specialized medications, whether the over-the-counter, a pharmacy stocks all that.
I see.
Yes.
Okay, you want to add that, sir?
Yeah, and also for the pharmacy, there where you find also injectables.
You find
injectables. Like the parenteral medications as well. There you find them. In a drugstore, like she said, you find the OTC, which is over-the-counter drugs.
Yeah.
So you don't really require those specialized medications. You also find cosmetics as well.
Oh.
Yes.
Okay. Now, I come back to you. Who is actually a pharmacist?
So in a language that can be understood by all of us, a pharmacist is someone who is trained to handle all medications and to ensure the effective and safe use of the same. So a person who is technically trained to handle medications to ensure that they are safe and they are used appropriately in a way that will not harm the patient.
Okay.
That is a pharmacist.
I see.
Yes.
Now, we have a difference between, there's a difference between qualification and competence.
Yes.
You may go to school and have the degree, but you're not competent. We have seen that many times.
Yes.
What if a doctor gives me a paper, prescription, and say, look, we don't have the medicine here, but go out there and buy your medicine. And I go out there to a pharmacy where they have an incompetent pharmacist who does not even know the quantity I'm supposed to take. The doctor has given me the prescription, I took it to a pharmacy, and I bought my medicine. But the pharmacist is giving me the exact drug that I went for. But he is not able to tell me what I should take one a day or one 3 times a day. And what's the danger there?
The danger of you getting the medication and not using the right way means, first of all, that your disease or your condition will not be cured. And in worst case scenario, you could probably die from an overdose or an underdose.
You could die from an overdose or an underdose.
Yes, it depends with the product that we're dealing with.
Yeah.
And that's why we are saying there's a need to have these qualified technicians, pharmacists in our drugstores.
Yeah.
So getting the prescription from the doctor is one thing.
Yeah.
And then getting the right product at the right dosage and everything else is another thing. And that's actually why we are here today, to let the public know the difference.
Yeah.
Yes.
After Jallah, tell me a little bit about that.
Okay, so like there is like if an incompetent person is in position, what you observe,
emphasize an incompetent.
Yeah, what you observe is this poses a higher risk on when it comes to dispensing errors, preparations of medications. Also, this also lead to poor interpretations of prescriptions as given by the physicians. So if that happens, then a patient comes to you, you understand that most of the medications that will be given, either it will be the label will be wrong, or the wrong medications will be given, which will pose a high risk of a patient, either the patient die or the adverse reactions from the medication might lead to the patient going into different conditions.
Yeah.
Yes.
And I just learned something. I didn't know that the underdosing can also cause problems.
It can, because I'll give you an example.
Yeah.
You're suffering from a very serious bacterial infection. If you don't treat it, it will advance and it will spread all over your body.
Okay.
So the dangers of that is, if that is not captured soon enough, you can die from an infection. Yeah. So those are the dangers of actually a patient not getting their medicine as it was ordered by the doctor. So that's exactly what it means.
That's exactly. And does underdosing also mean I have been told to buy 10 tablets?
Yes.
And I bought the 10 tablets for malaria.
Yes.
I took the first 5. I feel okay. The other 5, throw it away. Is that underdosing also?
Yes, because you did not complete the dose. Yes, because when you get the impression that you're feeling well and you leave the dose halfway, there's a danger. You've not completely killed the bacteria or the malaria parasites. So the malaria will come back again, stronger than before.
Stronger than before.
Yes.
That's what the rebels do.
Yes.
You know, during the war, we were here. When you drive the rebel back and you don't take them back to where they came from, beyond the border, we just cross them across the bridge and you stop them there. When they come back, they're coming with force.
Yes.
Now, what advice do you have for people who don't take the correct medicine?
Like she just mentioned something like the underdose, right? So if the patient is underdose, my advice to them is you always complete your medication, because disease condition will have a duration. Yeah. Right. If, for instance, you are to take this medication for like 3 days, which is twice daily, and you take it for 2 days, you feel okay. Yeah. That means you are underdosing yourself. The disease might resurface, which will be a very hard for you. Yeah. So my advice to them is to complete their medications based on the prescribed durations. Okay. Yes. Now let's come to another thing quickly.
Yes.
All the thing about pharmacy business. What about taking the wrong medicine for the wrong treatment, for the wrong illness? I'll give one example. Typhoid and malaria have the same signs and symptoms. They have the same signs and symptoms. You have not done your laboratory test. When you get to the drugstore or the pharmacy and say that you diagnose your own case, the first thing you do is to tell the pharmacist, I got malaria and I'm feeling cold. Now the incompetent and unqualified pharmacist, he wants money. You have told him your own case already. You have just told him you got malaria. And he does not care to know whether it is actually malaria or typhoid. He gives you medicine. He wants money. Now, the problem you have there is actually typhoid. But you are taking malaria medicine. What's the danger?
The danger is that First of all, your malaria is not even confirmed. You're self-treating.
You're self-treating.
You're self-treating.
Yeah.
So that means
Your doctors, the doctor said self-medicate.
Self-medicate.
Yeah.
So when you continue taking the malaria medicine and you don't have the malaria parasite, you'll get resistance to the malaria tablet. And when now you get the malaria infection, the tablet will not be able to work on you. So that is the danger number one.
Danger number one.
And that means now in the future you'll have to need to be hospitalized to get an injection version.
Make that clear to the public.
Yes.
You don't have malaria.
Yes.
When you are taking malaria medicine.
Yes.
What happens, you said?
Your body gets resistant to this medicine. And that means when you get the infection, the malaria, because you've been taking the tablet every now and then, it will not work now towards the parasites. And that means now you'll need a stronger version of the drug, which could most likely will be an injection.
Yeah.
And most of that will require you to be hospitalized to get the injection.
Okay.
So extra burden on you, extra cost.
Extra cost. And maybe death.
And maybe death. Back to our typhoid. You've not treated your typhoid. The symptom worsens. So now you'll be forced to go back to the hospital for a test. So at the end of the day, you end up spending so much money.
Don't forget about money, man.
Yes.
We're talking about your life, the death.
Yeah, it's
because I understand what you're talking about. There's no money already. But I think the danger there is, like you already said, the typhoid becomes worsened.
Yes.
Tell us more about it, Dad.
Okay, so like she mentioned about resistance. Okay, so if you are taking a medication for a specific disease condition, in that particular medication you are taking is not meant for that. Like you had a typhoid, like you mentioned, and the patient came and say, "Oh, I got a typhoid. Let me say I got a malaria." And what is, if I want to know as a person, what is the mechanism that you use if you have a qualified person? You want to know what is the mechanism that you have, or what is the test that you carry on before coming on that you have a malaria.
Yeah, no, I feel feverish. I feel cold. That's my only.
Yeah, but that alone cannot prove that you got a malaria, right? So the qualified person will want to know, right? So those are not qualified. They will want to be carried away and give, because they want the money, and then give you the medication, which will build a resistance. So the actual medication you're supposed to take, which is for the typhoid, you are not taking that. So at the end of the day, you notice that the disease condition will get worse because you are taking the wrong medication instead of the right medication for the right condition.
And I even heard that then the typhoid is going to bore hole in your intestine.
Yes.
Creating more trouble.
Which could lead to perforation.
Yeah, perforation, yes.
Yes.
And death due to too much diarrhea.
Yeah.
Because you'll diarrhea plenty, and diarrhea is one of the leading killer diseases. So before now you reach the hospital, you're already too sick. So
terrible.
Yes, it's
what are some of the challenges that pharmacists face on a day-to-day basis?
Okay. One, our patients pose a challenge sometimes. And this comes when you try to advise the patient on how to take the medicine, but they say, no, I will not do it this way, I'll do it my way.
Oh.
So patients not following instructions.
Then why did you go to the doctor? Since you know too much, why did you go to the doctor?
So that is actually one of our challenges at the pharmacy level.
But give me some examples.
Yes.
You're telling the patient, for example,
yes,
this illness you have needs injection.
Yes.
He or she tells you, no, I don't want injection, I just want tablet. Is that one of the examples?
That is one of the examples. Because definitely when a doctor is ordering a product, they've reviewed you. They know your disease state.
Yeah.
But then the patient will want to take the medicine their own way. So trying to advise them that taking it the right way will heal them becomes a challenge to some of our patients. And so we are really encouraging our patients to listen to doctor's advice, to the pharmacist's advice. If your pharmacist is saying, take these capsules 3 times a day, don't go take it once a day.
No.
There is a reason why you're told to take it twice a day and not once a day.
Yeah, there's a reason.
And so we urge our patients to please follow our instructions.
Yeah.
Because all of this is for their benefit.
Is it in your purview as a pharmacist to also give injection?
No, pharmacists are not trained to give injections. That's where now we come to the nurses. Because in the healthcare space, the training is, everyone is trained to do their work.
Yeah.
So you come to diagnosis.
But we have seen that in some places.
It's not supposed to be that way.
Oh, so the next time it happens, what do I do? Because I go to your pharmacy or your drugstore, so this issue you have, look, come behind the counter. We need to give you some injection. So no pharmacist is supposed to do that. That's not their job.
They are trained to do it, but they are not required to do it by the law.
By the law.
The law does not allow them to do it.
Doc, what do you say about that?
Yeah, that comes from terms of professional ethics. Yes, professional ethics. So that means you don't know your ethics.
Yeah.
So pharmacists are not trained to give injection. So if you see a pharmacist giving injection, that means you don't know their own ethics, right? So in many cases, pharmacists are trained to dispense, give the right doses. So if you see a patient, that means if pharmacists are giving an injection, that means they don't know their own ethics.
But you are a medical doctor. Yeah. You are Dr. Winston Jallah.
Pharmacist, doctor of pharmacy.
Oh, doctor of pharmacy.
Yes.
Oh, I see. Okay. In that case, you are just going to dispense and not to give injection.
Dispense.
Even though you are a doctor of pharmacy, yeah. Okay, I understand.
Yes.
Man, look. Tell me more about this whole pharmacy day. What is it all about?
Yes. So annually, the pharmacists all over the world celebrate the World Pharmacist Day, just to celebrate the good work that pharmacists do in different institutions. So it's celebrated 23rd September every year, just to celebrate pharmacists all over the world. Yes.
That's it's all not only in Liberia.
It's not in Liberia. It's a global event.
And what are you going to be doing that day? When is the day?
It's 23rd September every year.
Every year.
It's celebrated every year. And this year, the theme of the World Pharmacist Day is Think Health, Think Pharmacists. Because when you look at it, a pharmacist is like the first person you run to, even at night when you're sick, to try to get some first aid treatment before you can go to the hospital.
Yeah.
So we are appealing to the public to know that, yes, they can trust their pharmacist to handle their conditions before they can seek a doctor's opinion as well.
Okay.
Yes.
Will you be marching on that day?
Yes, I'll be there.
You'll be there?
Yeah.
Are you going to only allow medical practitioners to march, or anybody can join you?
It is a pharmacist event only, and we also allow the pharmacy technicians.
Yeah.
Those are those that hold an associate degree in pharmacy. They are also allowed to join us.
I appreciate pharmacists.
Dispensers as well.
Dispensers.
Yes.
I appreciate pharmacists. I love them. I want to join them. What's wrong with that?
You can sponsor the event.
So that's the best way to do it.
Sure.
Instead of marching that day,
yes.
You better just sponsor it, buying some water.
I'm telling you.
Oh,
yes,
okay.
Yes.
Tell us more about the products and services that pharmacists offer at Jahmale. What are some of the things you do at Jahmale?
Okay, so at Jahmale, we have a wide variety of services and products that we're offering at the moment. We have prescription drugs, we have over-the-counter products. You can walk in and buy your cold medicine, your vitamin C. You can get your supplements there. We also have vaccines, a wide range of vaccines, whether you're planning to travel and you require some vaccinations, whether you have a baby that needs vaccinations, we're also offering that. Whether you need blood pressure monitors, your sugar monitors, your walking sticks, we have a variety of products.
Oh, walking sticks?
Yes, we have. We have them for those that get leg problems. They can walk without walking aids. Yes, we have walking aids. So, and apart from that, we also do something we call medication reconciliation. So when you're walking, you're taking some medicine.
How much is the walking stick? You don't have that information.
I can give that at the moment. Yeah, but the price varies.
It's a beautiful. I can just buy for bluff, and I love to see people walking. It's beautiful.
It's nice, especially for our aged patients. Those who are struggling to walk without aid.
Oh.
Yes.
So those who are suffering from what the medical people call sarcopenia. Yeah, that's muscle loss.
Yeah.
Yeah, sarcopenia.
Yes.
I always advise people, you better do more walking. If you don't do more walking, you will suffer from sarcopenia in the future. Because sarcopenia is simply muscle loss.
Yeah.
Some people suffer from back pain because they sit too long. You sit too long, and they don't walk around. So when those things happen, you have to start using walking sticks.
Yeah, it comes in handy. when you get aged and all that, when you're struggling, when you need to take your evening walk. Yes. So at Jahmale, we have a variety of services.
Yeah.
And you can even call us and we will be able to advise you regarding your medications. Yeah. So we are trying to really go over and beyond to help our patients to ensure that they benefit fully from their treatments.
Okay.
Yes.
The program is Flashpoint, and I'm David Cote. We are here at ELBC every Friday from 10:30 to 11:10. And this program is also on Facebook. Just go to the David Cote page, Kortie. It's not Cotie, it's Kortie, David Cote. When you get there, I have 6,400 viewers already. And get there now and share the program. Share so that more people can get the information. And by the evening time today, it's going to be on Facebook. I'm making some arrangements now so that when we are here, we're going to be live on Facebook and on YouTube. So by this evening, you're going to be on YouTube. That's sure it's going to be on YouTube. But for now, go to the David Cote page, DAVID, Just get there. And then the pharmacists who are sitting here, their numbers are also on the Facebook page. You get there, you can contact them and ask them some questions. Tell me a little bit more about the day, if you are going to be there. Is it only the marching and what else? Tell me a little bit more about the day.
Okay, so on that day, we normally have awareness. Telling the public about the role of pharmacists. Like this year, the theme is Think Health, Think Pharmacists. So they will mainly be talking about their role, what their role in the healthcare system, in government or entities as well. So we're all going to be there. We're going to celebrate the day as well. So.
Are you also going to be doing some education for the pharmacists? Because we just mentioned that some are qualified but not competent. You know, going to school and getting that big degree or certificate is one thing, but being able to defend the paper is another thing. So what education and advice are you going to be giving your colleagues, those who are not up to the task? Do we have a special time for them to be trained properly?
Sorry. So on that day, actually on the World Pharmacist Day, we will have a talk and they will be educating us on how best as pharmacists we can position ourselves to meet our patients' needs better. When it comes to the issue of incompetence and all, by right, a pharmacist is a lifelong learner.
A lifelong
learner. That means for the rest of your life, you'll have to keep updating yourself.
Oh, okay.
Reading every year because we get new medicines coming in, others going out. And so as a pharmacist, you're required to keep reading and join seminars and webinars online. So incompetence is something that at an individual level, someone should be able to address that. But with the Pharmaceutical Society of Liberia, they are able to educate the pharmacists on various topics, and they are coming up with topics as well to address the needs of the pharmacists in the country. Yes.
Let's talk about the OTC a little bit, Dr. Jallah. Most people don't care to request for, even though I think it's a law, I don't know whether it's a law in this country, they don't just go to the counter or to the drugstore and buy medicine and simply present a prescription paper. But what are those drugs, Dr. Jallah, that one can just go and buy without prescription? Are there any drugs that anybody can just go and buy without prescription?
Yeah. Like the paracetamol is one, OTC medication. We have those cough medication.
Pardon?
Cough medication.
Oh, cough. All right. Yes. Cough medicine.
Yes. So these are some OTC medication that you can walk to the pharmacy or the drugstore without prescriptions and get them.
Paracetamol is one of them.
Yes, one of them.
But what is the illness that I have to use paracetamol for? So you're telling me now that I can just go and buy paracetamol and treat myself? I don't understand.
Okay, I can come in.
Yeah.
So we're giving you paracetamol not to treat, but to manage your symptom, to buy you time to go to the hospital.
I see.
Because we don't want you to get so high fevers, you start getting convulsions before you start seeing the doctor.
Oh.
So basically, although paracetamol is an over-the-counter product, we limit the number of days that we serve. So by right, you should not take more than paracetamol for 3 days. If the symptoms are not resolving, you should be able to see your doctor within 3 days of the unresolved fever.
What symptoms am I going to be having to start go and buy my paracetamol? What are the symptoms? What are those symptoms?
Pain, fever, headache. Yes.
So if I have pain or headache, I can buy paracetamol.
Fever.
For fever.
Yes.
And take it in the meantime until I can get to the hospital.
Yes.
And I like the way you put it. It should not be for more than 3 days.
Yes.
Because if you continue to take it from time to time, just keep taking it 1 week, 2 weeks, you may have a liver problem.
True.
You may have a kidney problem. So the program is Flashpoint, and I'm David Cote. We're here on every Friday, beginning from 10:30 to 11:30, and we discuss health. Some people, one of my former students called me one time from the States when I was on this program. He said, when did you get into medicine business? I know you to be an English teacher and a civics teacher. When I said, well, I just got there. I'm not teaching medicine, I'm just inviting doctors. Okay, at sharp 11:30, we'll open the line so that you who are out there can participate and be part of this program. I was not here for 2 weeks. I hope people know that I'm back, and so that we can get some interaction. So when we take the break and come back, the number you're going to call to participate will be 0777 511 977, 0777 511 977, or 0886 511 977. Those are the numbers to call to participate by the time we open the lines. We'll take a break and we'll open the lines so that you can be part of this program. Ask any a good question. These people are from one of the leading medical institutions in Liberia. All of you know about Jahmale. There's one or two things I can say about them. Number one, they have sophisticated machines, or what I want to call professional machines and expertise. For example, the fluoroscope, which was just installed about a month or two ago. That one is an action equipment where the doctor will be looking in, you see things moving, all this kind of thing. They also have the MRI, which I don't think is anywhere else. They have the CT scan. And these are medical x-ray machines that people leave this country for and go to other countries. You don't have to go anywhere. No, you don't have to. Number one, you better have the money to travel from here to Ghana. That's what has been happening in many cases. But Jahmale made it easy by saying, we will provide them here. There's a risk in going to other countries. Like I said before, I have traveled to 17 countries, but you will not believe I'm still not used to airplane. I'm afraid of planes. When I'm in it, I pray to get down quickly. So there's a risk in riding plane. You may not come back. Number two, it's costly. Plane tickets. Number three, you need hotel bills. When you are traveling to go for any treatment out of the country, you're not going alone. You're going one or two persons. You got to pay hotel bills. You got to pay for, in fact, it's much more expensive to do the treatment in other places. The MRI here, I think it's around 2 or 3 minutes. I'm not too sure. But when you call them, they're going to tell you what to do. But when you do it here, it's easier. If you're traveling, it's much more expensive. Plane ticket for you and the person who's carrying you, hotel bill for you and the person who's carrying you, and the treatment there is far, far expensive. So that's how far I can tell you about Jahmale. They have professional equipment and the expertise. They will tell you more about that. So let's take a short break, and when we come back, you will have to call those numbers now: 0777 511 977 or 0886 511 977 to be a part of this program. Let's take a break.